Omicron variant is extremely concerning at this point for the two main reasons. One, it spreads so fast, faster than any other variant, and dodges the immunity provided by previous infection and partially by the vaccine as well. So that is something that is different than we have seen before and poses a lot of potential risk. And when I say this dodges the vaccine, it just the vaccine is still our number one tool to deal with this. If we get the boost, we're going to restore the immunity as we had it at the beginning. The vaccine gives you several layers of protection. One is to get infected in the first place. That's the one that weakens, and that's the one that allows this virus to infect you to begin. Then the second layer would be, is it going to be protecting us from getting very sick and hospitalized? That is well preserved, even with the original vaccines, with the primary vaccines that you got many months ago, you have protection. And the last one is, as they're going to protect us from ending up really sick on the vent or dying. Yes, that's a third layer of protection, the T cells. Those are also well conferred by the original vaccines. So it's just the first layer of protection that we want to be restored. The vaccine, by getting the booster, is going to protect you from getting mild illness or even asymptomatic. You don't want to be a carrier. Omicron could be potentially dangerous, and this is not the time to leave your guard down. You have to muster all your energy and focus on this. Get vaccinated, get boosted, follow all the public health advice, and do as we have recommended throughout the pandemic with all these non-pharmacologic interventions. We've only been looking at this from an epidemiologic point of view, how it behaves in humans for the last 3 weeks. And what we're seeing early on, and keep in mind, we haven't had a chance to study this so early in the past, is that the cases appear to be relatively mild. When we say mild, means that the proportion of cases that end up in a hospital or dead seem to be less than with Delta or with Alpha, the previous strains. But it's early, because the studies that we've done are in a South African population. Keep in mind the South African population is young. The average age in South Africa is 29 years old, as opposed to the US, where we're 39. And in Florida, we're probably even 10 years older than that on average age. So what will happen as it hits older populations is yet to be found and yet to be discovered. But I think the early signals are that, at least in younger populations, such as the South African, it doesn't lead to as many hospitalizations, or at least a proportion of hospitalizations and deaths. We have to interpret that correctly, because it could be that the reason that is that leading to hospitalizations or deaths is because there's immunity in the population, either vaccine-acquired immunity, so the vaccine gives you protection from ending up in the hospital or dead, or previous infection. For example, in South Africa, even though only 25% of the population is infected, another 50% or 60 or perhaps even a little more had been previously infected in massive waves that they've had with Delta, Alpha, and Beta in the past. So that may have been what is protecting them from that. So there's still a lot to learn about this mild concept. I'm rooting for that, and I'm sure everyone is. We hope that turns out to be mild, because the other characteristics are something that gives the virus an advantage. Do not let your guard down. This variant is serious. It's coming. It's going to be not just here in Florida. It's going to be all over the United States, in every country in the world. Even the countries that have controlled this before, like China, New Zealand, all those, they will be hit with this one. We don't know to what extent. It may be just fast and furious and goes away, infects a lot of people. We hope that that's what it is, but we just don't know. So don't let your guard down. The most important thing that you can do is be vaccinated. If you haven't been vaccinated, this is your opportunity to do it, and do it quickly. Do it this week. This week is better than next week. Next week is better than this following week. The earlier that you're protected, the better. This variant is around the corner. Remember, it takes 7 days from the booster to take effect. So do it as fast as you can. And then we have all the other things that we've been doing through the entire pandemic. We need to go back to them. They're very useful. And for this variant, the vaccine itself, it's not going to be enough. We need vaccine plus strategies, and the strategies are the one we've been talking about all the time. Wear masks, and especially indoors. Minimize large gatherings. Stay with small groups inside. We have tests now available. There are home tests. Use those tests. Stay home when you're sick. And don't get confused with other minor symptoms about not being this. Just pay attention to that. Stay home when you're sick. All those things. Hand hygiene is going to be important as well, but keep in mind this is a respiratory virus, so all the other things that we've done before, good ventilation, all those things that we've talked about it are going to be critical as well. If we get in small groups, everybody's vaccinated, preferably boosters, the ones that are booster, I think you're going to be as safe as you can be. I think gathering is important for all of us, but you have to do it with caution. If you are unvaccinated, be careful. Don't expose folks that are immunocompromised or they're unvaccinated because they cannot get vaccines, like children of young age. So those things I think that are going to have to be heeded. Wear the mask, be in ventilated places. Outside is better than inside. We live in Florida. We're blessed. That may not happen up north if you happen to go up north, but if you can get tested before getting together, that's going to be also a plus. That's one of the vaccine plus strategies. So use all of them and be very cautious. Be careful. This Omicron is, of all the variants that have been coming our way, this is the one that has me the most worried. We are hoping that this turned out to be something that comes through fast like a hurricane, and it goes away fast as well. But it's a potentially dangerous variant, and we all have to be aware of all the things that are happening. Please stay tuned, listen to the news, and follow the public health advice and get boosted.